Let's look at the pelvic girdle, how the two individual hip bones come together to create the pelvis. We'll identify the pelvic walls, look at the muscles that make up the pelvic diaphragm, the different ligaments that we're going to need to know in the pelvis, and also look at the urogenital diaphragm. I'm going to show you first on the model, and then bring in our pro section to have a look at what they all look like in section. Okay? So first, we're going to look at, as I said, the model. We'll see, to orient ourselves, we have the sacrum that's found within here. We have the coccyx right here. And we see how the sacrum articulates with the lumbar vertebrae above. Laterally, the sacrum articulates with the hip bones, making the sacroiliac joint, synovial joints. Anteriorly, we see the symphysis pubis made between the symphysial surfaces of each pubic bone. Now that we have the pelvic girdle, we can see the walls that make up the pelvis. Anteriorly, we have the back of the pubic bone. Posteriorly, we have the sacrum. And also making up the posterior pelvic girdle, we have the or posterior pelvic wall, we have the piriformis muscle, which is going to end up coming off of here and going through the greater sciatic foramen. Laterally, we have the medial surface of the hip bone, the obturator membrane, and we also have the obturator internus muscle. Okay, and that makes up the lateral border of the pelvis. And then inferiorly, down here where my hand is, will be the pelvic diaphragm. And then replaced anteriorly between the ischiopubic ramus, or rami, as the UGD. Okay, so let's look at the two ligaments that we need to know in the pelvic girdle. Most posteriorly, what we have going from the inferior or inferolateral surfaces of the sacrum and going to the ischial tuberosity are the sacrotuberous ligaments. So going from the inferior portion of the sacrum to the ischial tuberosity, sacrotuberous ligaments. Anterior to that, we have this guy here, which goes from the lateral surfaces of the sacrum to the ischial spine. This ligament is called the sacrospinous ligament. Sacrospinous. The formation, because of these two ligaments, we have the formation of the greater sciatic foramen and the lesser sciatic foramen. Those become important because the piriformis muscle will come through the greater sciatic foramen, and the obturator internus muscle will go through the lesser sciatic foramen. Now, the muscles that make up the pelvic diaphragm, there are two major muscles that do so. First, you have the levator ani, and then you have the coccygeus. Levator ani is going to actually attach to the back of the pubic bone. So if I can show you this, it'd be right in here. Okay? It also will attach to what is called the white line, which is a thickening of the fascia that covers the obturator internus muscle. And the white line essentially runs from here, see if I can get a better angle here, from here all the way back to here, okay? So essentially the levator ani attaches to the back of the pubic bone, the white line that goes along here, and then also to the ischial spine. Since it originates from there, the muscle fibers will be running inferiorly and medially. And those fibers will end up going into two thickenings of connective tissue, which are going to be found on either side of the anal canal. If the anal canal were my probe right now, the perineal body would be anterior to it, and the anococcygeal body would be posterior to it. Now, I understand that's a little bit difficult to see in the camera here, okay? But just imagine that if you had the anal canal in this area, you would have the perineal body basically where my index finger is, and the anococcygeal body where my thumb is. Okay? So those fibers all come down and create the bulk of the pelvic diaphragm. The other muscle that's involved in this is the coccygeus muscle. The coccygeus muscle is going to be going from the ischial spine and insert into the lower edge and upper part of the sacrum, which is essentially the same place where the sacrospinous ligament attaches. However, the coccygeus muscle is going to be deeper, and it's making up part of the inner surface of the pelvic diaphragm. Whereas the sacrospinous ligament, you're going to see on the posterior surface if both are present. So if you have coccygeus muscle, it would be in here, and then the sacrospinous ligament would be running behind it. Those two muscles make up the pelvic diaphragm. Then, as I was saying, anteriorly, the pelvic diaphragm is replaced by the urogenital diaphragm. And the urogenital diaphragm spans between the two ischiopubic rami. The urethra passes through that in both sexes. The vagina passes through it in females. And in males, the prostate rests right on top of it. It's composed of 3 layers. You have your superior fascia, which the prostate rests on in males and the bladder rests on in females. Then you have the sphincter of urethra, which is the middle. And then the inferior fascia is the lowest or the most inferior part of the urogenital diaphragm. And that's in males is where the penis will attach to. Now let's switch out. Oh, sorry, there's one more muscle I didn't tell you about. So I talked about the obturator internus muscle here, which is going to be covered by a membrane, and that thickening of the membrane is what creates the white line along here. And then another muscle I need to tell you about will be attaching to the upper parts of the sacrum, lateral surfaces. Its fibers will kind of come together in a pear shape, exit through the greater sciatic notch, come around, and insert into the head of the femur. And that's the piriformis muscle. So let's have a look at what these look like in the actual section here. All right? If we can get it to stay up. All right. So first, let's have a look at the posterior side, and we'll be able to make out what are the different ligaments that you need to know. Okay? First, let's look at this guy because it's probably the most obvious of the 2 ligaments. This is the sacrotuberous ligament. If you can make out here, this V here is actually the sacrum. Below, between the tweezers right now, is the coccyx. Okay? So you have the sacrum coming down here into the coccyx. So on the inferior portion of the sacrum, what you have is the fibers running from the sacrum to the ischial tuberosity. Ischial tuberosity right here. Sacrum to ischial tuberosity, we have the sacrotuberous ligament. If you remember, you have a little bit anterior to it, running from the sacrum into the ischial spine, which should be right here. We have the sacrospinous ligament, of which we have some fibers right there. And what that creates is the greater sciatic foramen and the lesser sciatic foramen. While I'm on the posterior surface, I might as well point out this muscle here, which is originating from the sacrum, a little bit more superiorly, the lateral surface. It's coming out the greater sciatic foramen and inserting into the head of the femur. This is the piriformis muscle. Okay? All right here. If we want to see it on the other side, this is the piriformis muscle right here. Okay? Inserting, coming out the greater sciatic foramen and inserting into the femur. On this side, we also see our sacrotuberous ligament, and underneath would be running from the sacrum to our ischial spine, the sacrospinous, more anterior. If we look underneath, okay, we're going to see this would be the ischiopubic rami, and this across would be the urogenital diaphragm. And if we look a little bit posteriorly, you'll see the muscles that make up all underneath here would be the muscles of the pelvic diaphragm, majority of which are the levator ani muscle. If to orient yourself, remember that the sacrum is still back here. So the coccygeus muscle is going to be going from here to here, okay, much smaller muscle, so the fibers would be a little bit back further there, whereas up here you have all levator ani. Okay? Let's turn this around and look at the interior part now. Again, we have our lumbar vertebrae, our sacrum, upon which our rectum will be sitting, starting at S3. Right here we have some psoas major muscle and our iliacus muscle. All right? If we look down one side, I'm going to try to zoom this in here in a second. Okay, so if I'm turning the girdle a little bit, right? So right now, if we're looking deep, we're seeing some fascia, which is actually going to be covering most of the muscle of the pelvic diaphragm, which is levator ani. If you had, you can actually see some of that muscle. If I open up, see, make it a little brighter, you can see some of that muscle underneath the fascia right here, although it's going a little bit blurry on me once I put my hand in there. See if this helps. Down there, that looks like muscle fiber of the levator ani covered by this fascia. Now, this fascia is actually the obturator internus membrane, and along its side, you can see this thickening, how it spans from the back of the pubic bone all the way back towards the ischial spine. That there is actually the white line. Can't keep it in focus. There we go. That there is the white line, okay? And then this muscle here is the obturator internus muscle. And its fibers come together and exit out the lesser sciatic foramen. And this is where some of the white line, the back of the pubic bone, and the ischial spine are where levator ani is going to attach to and insert into the, let me zoom out, the perineal and the anal coccygeal bodies. Okay? Then, as I was saying, that the coccygeus muscle would be a little bit further back when we're looking at the posterior view. And what that's going to be is, you can't really see the muscle fibers again. They're covered by some connective tissue, but they're going to be running from the sacrum to the ischial spine, which would be right in here. Okay? Let me zoom in again, see if I can actually show you this. So here we are on the sacrum here, and the muscle fibers would be going across to the ischial spine. Okay? Those muscle fibers in that area, not this, that's not it. You got to reflect that. If you could push all this away and see like that stuff right there, that's actually the coccygeus muscle, okay? And remember that its attachment points are the same as for the sacrospinous ligament. And I suppose that is a review of the pelvic wall and pelvic diaphragm. Zoom out. Give you one final look. All right.